Hello, and welcome to this episode of In Discussion With from PharmacyUpdateOnline. Today I'm talking to Ramandeep Kaur about the work of a clinical information officer. Could you start by introducing yourself?
Hi, Christine. My name is Ramandeep Kaur, and I'm the Group CXIO for the University Hospitals of Leicester and the University Hospitals of Northamptonshire. University Hospitals of Northamptonshire contains both Kettering General Hospital and Northampton General Hospital. I'm also a proud pharmacist by my clinical background.
And can you give us a brief overview of your role, what your current job involves?
As a Group CXIO, I have responsibility for the clinical professions of AHPs, pharmacy and healthcare scientists, and anything else that doesn't fit within medical, nursing and midwifery from a digital clinical perspective, which means I'm the bridge between those clinical groups and our digital and data team. In addition to that, I look after the user experience of all of our colleagues across UHL and UHN in terms of their experience with our digital systems, anything where they may have a concern or they want to speak to me about a new solution, for example, which is super exciting and means that I get to hear lots from all of our different colleagues. In addition, I also have the pleasure of looking after our risks across UHL and UHNs, anything related to digital risks, and currently involved in leading our LIMS procurement with some of our digital colleagues. So that's something completely different and exciting for me, but also for our organisation too. And alongside, I've got a passion for clinical safety, which ties very neatly into the risks that I mentioned earlier. So that's quite an important part of the portfolio across the digital clinical aspects. So lots of things that I'm involved in. I'm more than happy to share more with other colleagues if they'd like to reach out.
And my notes say that you address challenges with electronic patient records and manage risks within the healthcare environment. Could you give us one or two examples of these types of things?
Yeah, so that's an interesting segue from the point that we just mentioned around risks from our previous question. So I think one of the really important parts with any digital transformation is moving, particularly from paper to digital. We had a really exciting go live last year at Northampton General Hospital, where we moved predominantly from paper-based systems, but also some digital systems over to our new electronic patient record, which is called Nerve Centre. We use Nerve Centre already at University Hospitals of Leicester, so lots of learning that we've gained both from UHL but also other hospitals within the East Midlands acute provider network. So lots of the other hospitals within the East Midlands utilise Nerve Centre. So in terms of problems and challenges and resolving those, what was really important and continues to be really important is actually sharing the learning across all of the organisations together, being able to manage risks and actually understand what's super important for our staff, but also our patients. Thinking about our patients, one of the new things that we've also introduced is a digital patient reference group, which I sit on. So it's really good to hear from patients firsthand across Leicestershire and Northamptonshire about their experiences with digital too, and the challenges that they have and problems so that we can help to resolve those.
At present, you are the interim Chief Clinical Information Officer, and I'm interested in your career pathway. How did you get into this in the first place, and what has the pathway been?
Yeah, truth be told, I fell into digital by accident back in 2014. Lots of people, especially within the pharmacy world, end up within digital by accident. I'd come to Leicester to study medicine back in 2013, did that for a year. I know, completely different. So I'd already done pharmacy as my first career, as it were. Then went to study medicine, and due to personal circumstances, that didn't quite work out as the way it was intended to be. But I'm a strong believer that there's a plan written for everyone already. And lo and behold, I found myself at Leicester Royal Infirmary working as a locum in July of 2014. Looked at this job that was related to electronic prescribing and medicines administration on the first day that I was there, and I thought, oh, I like computers. We'll apply for this job. And that is honestly like the way this journey started. I absolutely love technology, and thoroughly enjoy working in the NHS. And for me, that was the biggest stepping stone. Like, as they say, the rest is history. But in terms of progressing from applying for that job, getting that job, albeit that wasn't so straightforward either. Initially, I wasn't shortlisted because there was a slight hiccup in the HR process, and then I got shortlisted and had the interview and was successful. So I started my digital career, as it were, on the 6th of October 2014. So we'll be coming up to 12 years later on this year, which sounds quite crazy when I think about it. But for me, to have grown from being a baby electronic prescribing and medicines administration pharmacist back in 2014, to have then progressed through learning about EPMA and then moving to working on other digital projects when I moved to London for a couple of years to do more EPMA work, but it gave me an opportunity to explore more opportunities, more things within digital. So, for example, I worked on a project to replace all of our single screens with double screens in the pharmacy department, worked on the procurement of an EPMA solution, worked on our prescription ordering system. So there was lots of different opportunities there. I also went on and did the digital health leadership program as well. So for me, those all were great stepping stones to then becoming the first group Chief Clinical Information Officer as a pharmacist back in 2022. And then from there, I'm now the interim group CXIO at the University Hospitals of Leicester and Northamptonshire, as I've mentioned earlier. So to have grown in that career pathway, I thoroughly enjoy mentoring other people too, because I believe quite firmly that someone gave me an opportunity back in 2014. Someone believed in me. And it's really important for me to then give back and believe in other colleagues and pave the way for them. I've been very lucky to have also been nominated and won a few awards along the way, which is really humbling because I'm a strong believer that I haven't got to where I've got to because of only my efforts. Like, a lot of this is down to the teams that I've been so lucky to have worked with. I'm very, very grateful for the Chief Clinical Information Officer of the Year award back in 2024 for Digital Health Networks. I was a finalist for Digital Leader of the Year last year for the HSJ Digital Awards. And then later on in the year, in December 2025, I was listed in the top 100 digital leaders for digital technology and innovation. But none of those accolades would have been possible without the support that I've had along the way. And I'm really grateful for others. And my career journey has been really varied and isn't the normal career journey you'd perhaps anticipate for a pharmacist. But I absolutely would recommend the digital world to any of our pharmacists that are coming through. If you're a pharmacy student right now and wondering what are the careers that are there are lots of opportunities within this space. So definitely go out and seek those opportunities with others.
You are a pharmacist, but your career pathway has been very different from that of most pharmacists, as you've just explained. What advice would you give to a young pharmacist who thinks they might be interested in a career in clinical information?
Absolutely. For me, one, find a mentor. That's really super important. And once you've found a mentor, don't feel that they need to be your mentor for the rest of your career. Actually, I've had a number of different mentors along the way, and some people who I now know but are no longer my mentors, and that's absolutely fine. The other thing would be that there will come a point where you don't need a mentor per se anymore, but you do need a coach. So actually think about that as well. But I think for pharmacists starting out in their career, definitely find a mentor, find your tribe, find the people within the space, within the field that you want to go into. So for example, let's say you wanted, it doesn't even have to be digital. If you wanted to be involved in clinical trials, for example, find the people within the clinical trial fields that are your tribe, the people that are going to support you. The other final thing I would say, and this is something that I say to a lot of people, ultimately you are your own champion. You are the person that is going to champion you. Nobody else is going to do that for you. However, the really important part is to find the people around you who are going to be your cheerleaders. And I always say that because actually, for me, as I mentioned earlier, I wouldn't have got to where I've got to without the people around me. I've done a lot of digital qualifications in the last couple of years. I've done other qualifications. I've won, some amazing awards, but that is testament to all of the people along the way who have supported me, who have been a cheerleader. And for me to push myself outside of a comfort zone, I've broken a lot of glass ceilings and barriers along the way to get to where I've got to. And anything is possible. Like, really, this is your opportunity to fulfill your dreams and your hopes and desires, and go out there and find that career that truly suits you.
Ramandeep Kaur, thank you very much for talking to us about this very interesting topic. For more information about Ramandeep Kaur's work, please visit the website using the links in the description, and be sure to subscribe for more news, videos, journals and podcasts. For updates straight to your inbox, please follow the links below. And thanks for watching.